The House will come to order. I am excited to welcome Representative Weinberg's children, Yanni Weinberg and Heidi Weinberg from Loveland Classical in Loveland, Colorado, to lead us in today's pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Schiebel, please call the roll.
Representatives Amabile, Armagost, Bacon, Byrd, Representative Byrd is present. Bockenfeld, Basenecker, Bottoms, Bradfield, Bradley, Brown, there, Catlin, is here, Doherty, DeGraff, Degree Kennedy, Dixon, Duran, Majority Leader Duran, English, here, Epps, Evans, Frizzell, Froelich, Garcia, Representative Garcia. Yeah.
Excused.
Gonzalez Gutierrez, Hamrick, Representative Hamrick.
Excused.
Okay. Hartsook. Herod. Holtorf. Judah. Joseph. Kip. Leader. Lindsay. Linstead. Luck. Representative Luck. Lukens. Lynch. Mabry. Marshall. Martinez. Morrow. McCormick. McLaughlin. Michelson Janae. Ortiz. Parenti. She's right here. Puglisi. Ricks. Representative Ricks.
Excused.
Sharbini. Sirota. Representative Sirota.
Excused.
Snyder. Soper. Story. Representative Story.
Excused.
Taggart. Titone. Valdez. Velasco. Vigil. Weinberg. Weissman. Wilford. Wilson.
That would be awesome.
Winter. Woodrow. Young. And Madam Speaker.
Here. 64 present, 1 excused. We do have a quorum. Representative Weinberg.
Thank you, Madam Speaker. It's a privilege to serve with you. Good morning, General Assembly 74th. I have it under good authority that at least 80% of you like children. So this morning, I urge an aye vote in honor of my little boy, Jonathan, and my daughter, Heidi. I'm pretty sure you've got no choice at the matter. If you do not go for this morning, you do not like children. So, Madam Speaker, I move that the Journal of Tuesday, February 7, 2023, be approved as corrected by the Chief Clerk.
And members, these are really cute children. You have heard the motion that the journal be approved as corrected by the Chief Clerk. All those in favor say aye. Aye. All opposed say no. The motion is adopted. Announcements and introductions, members. Representative Weissman.
Thank you, Madam Speaker. Good morning, members. That's a hard act to follow.
Members. Thank you. Please proceed,
All
Rep.
right,
Weissman.
everyone, Judiciary Committee is so much fun, we're actually doing it twice today. 1:30, we will meet as Joint Judiciary in the old Supreme Court to hear a couple of final SMART Act presentations. Immediately upon the adjournment of Joint Judiciary, House Judiciary will sit in the Old State Library, which is the room across the way here. We have 2 bills as House Judiciary, 1027 and 1024. So we'll see you at the old Supreme Court at 1:30 and thereafter in the other room. Thank you.
Representative Hartsook.
Thank you, Madam Speaker. Good morning, everyone. I would like to call your attention, please, members, to a fine group of oral surgeons over here, if they would stand, please. These are oral maxillofacial surgeons. They're part of the Colorado Oral Maxillofacial Society. And part of this group that I get the distinct honor and pleasure of doing this, would be my wife here on the side, sitting over here. So the Colorado Society of Oral Maxillofacial Surgeons, it's an association, and they work a lot on the facial trauma, wisdom teeth, and a lot of other things. But I've got a set of notes, but I'm going to skip those because I know the story, and I want to brag a little bit here. As you know, I served 26 years in the Army. Well, my wife and I met in the Army. She's also an Army veteran. And during our service, I deployed, and we found out she was pregnant with our first son. So not only did she go through the oral surgery residency program, which is a 4-year residency, she did that while I was overseas, which I'm often reminded of, but I said, it wasn't my fault, it was Uncle Sam. But she did that as a mom, as a surgical residency, and as a doctor. And so now she recruits people to come into the oral surgery program. She did all of that, and you know how everybody has bookshelves and they're lined with books? Well, I came back from Iraq, and they had the skulls of the soldiers that they rebuilt and put back together. That's what these group of surgeons do. You have an accident, you fall, you get in a motorcycle or a truck or your construction accident, they put you back together. They do phenomenal work like that. And so today we're recognizing them, and then tonight we would invite all of you out to their first reception that they're holding down here. That's in the bulletin that they'll be having at 5:30. So thank you so much.
Representative Amabile.
Thank you, Madam Speaker. I just wanted to mention that Business Affairs and Labor will be meeting today upon adjournment. We'll be hearing 2 bills. Senate Bill, 23019, and House Bill 231099. Be there as 10 minutes after adjournment. Thank you.
Representative Michelson-Jeannet.
Thank you, Madam Speaker, and good morning, members. Public and Behavioral Health and Human Services will be meeting this afternoon at 1:30 in room 107, our regular location. We'll be hearing House Bills 1124 and 1117. See you then.
Representative Assistant Minority Leader Puglisi.
Thank you, Madam Speaker. I have some guests here today that I want to introduce you all to, the future generation of legislators. They are Academy District 20 in Colorado Springs in my district. And our students are here today to learn on hands-on civics lessons. So thank you all for coming up today. We really appreciate having you.
Welcome. Representative Byrd.
Thank you, Madam Speaker, and it is an honor to serve with you.
And an honor to serve with you.
Members, one of the best breakfasts of the whole session is happening tomorrow. I hope you can join the Realtors. So tomorrow is Realtor Day at the breakfast, or Realtor Day at the Capitol. You can join them for breakfast at the Sheridan Place, Denver downtown. You need to RSVP, and hopefully you will have seen this invitation, either an electronic copy in your inbox or a printed copy on your desk. But I know I will be there, and I hope you will join me to network with our realtors.
Thank you. Representative Lindsay.
Thank you, Madam Speaker. It is an honor to serve with you.
And an honor to serve with you.
Members, I have some guests in the chamber today as well. I would like to introduce you all to high school students from Goal High School. They're all in white here along the wall. So for most of them, this is their first trip to the Capitol. They are very excited. When I was speaking with them this morning, many of them asked, how do you get engaged? How do you figure out what you care about? So we talked a lot about that, and I told them that no matter where you line up on the political spectrum, most important is that you are engaged and that you vote, and that I did tell them all of us here are interested in hearing their voices. So if any of them call your office or send you an email, make sure that you respond so that they know that I'm telling the truth. But for any of you that don't know, I have 4 kids. They're 15, 16, 18, and 21. And in this group, I see the faces of my children who are young, just starting out life, trying to figure out who they are. And I'm so glad that they are here today. And who knows what's to come? Maybe some of you will be here, but please let us know what you're thinking. We want to hear your voices. Thank you for being here.
Representative Kipp.
Thank you, Energy and Environment Committee members. We will be meeting today 15 minutes upon adjournment. We have just one bill, HB 23-1134. I'll look forward to seeing you all there.
Terrific. Representative Martinez.
Thank you, Madam Speaker, and it's an honor to serve with you.
And an honor to serve with you.
Thank you, members. So I just want to give a reminder for the breakfast tomorrow. You should have all had this on your desk. I'm a little partial because I'm an Adams State alumni. I know there's many of you out there, but I also worked at Adams State, and I hear that they have the best breakfast burritos and coffee tomorrow at the first floor rotunda, so we hopefully see you tomorrow. Thank you.
Thank you. Representative Vigil.
Thank you, Madam Speaker, and can I just say it is an honor to serve with you.
And an honor to serve with you.
Members, I have requested and been granted an absence from the House floor on Monday, February 13th. I know you're all going to miss me so much. Try not to cry. You'll survive just as I will, and thank you.
So approved. Representative Froelich.
Thank you, Madam Speaker. It is lovely to serve with you.
And lovely to serve with you.
We just have one bill, Housing Local Government Transportation Committee, this afternoon, 1:30, LSBA 1165. Be there.
Representative McLaughlin.
Thank you, Madam Speaker. 2 messages today. Education Committee, we're listening to House Bill 23-1093 at adjournment today. And on Friday, we have the Colorado Association of Naturopathic Doctors who will be here for Legislative Lobby Day, and they're going to have a light breakfast outside the Supreme Court chambers from 8 to 9 a.m. Hope to see you there. Thanks.
Representative Snyder.
Thank you, Madam Speaker. Well, it's Colorado Chamber Day at the Capitol, and we are joined by more than 100 business leaders and local chambers of commerce from across the state. They will be down in room 109 from 10:30 to 11:30. If you want to stop by and say hi to your local chamber, please help me welcoming all these wonderful business leaders to the Capitol.
Representative Soper? No. All right, members. Madam Majority Leader.
Thank you, Madam Speaker. I move that the following bills be made special orders at 9:25 a.m. House Bill 1071, 1064, 1101, and 1106.
Seeing no objection, the bills listed by the Majority Leader will be made special orders at 9:25 a.m. Representative Doherty. Members, you've heard the motion. The House will now resolve itself into the Committee of the Whole for consideration of special orders. Representative Doherty will take the chair.
The committee will come to order. With your unanimous consent, the bills will be read by title unless there is a request for reading a bill at length. Committee reports are printed in your bill folders. Floor amendments will be shown on the screen and on your iPads. Bills will be laid over upon motion of the Majority Leader. The coat rule is relaxed. Mr. Schiebel, please read the title of House Bill 23-1071.
House Bill 1071 by Representatives Amabile and Bradfield, also Senator Simpson and Fenberg, concerning the authority of a licensed psychologist to prescribe psychotropic medication for the treatment of a mental health disorder.
Representative Amabile.
Thank you, Madam Chair. This morning, Rep. Bradfield and I are presenting to you House Bill 1071. So I would like to move House Bill 1071. There is no committee report.
To the bill.
I would like to now move amendments L004 and L009 and ask. Okay, I'd like to move L004 and ask that it be displayed. And also, members, you did get this amendment on your desks well in advance of today's hearing.
L004 has been moved and is properly displayed. Representative Amabile.
I'd like to move L009 and ask that it be displayed.
L009 has been moved and is properly displayed.
Thank you. So L009 fixes a typo in L004, and I would ask for a yes vote on L009.
Is there any discussion on Amendment L004? Representative Bottoms.
No, 009.
L.
09. L9.
The amendment to the amendment, so we're on L009. So Representative Bottoms, please proceed if you. Okay. Representative Amabile.
So I ask for a yes vote on L009.
Is there any further discussion on Amendment L009? Seeing none, seeing before us is the passage of Amendment L009. All those in favor say aye.
Aye.
Those opposed, no. The ayes have it. Amendment L009 is passed. To Amendment L004, Representative Amabile.
Yes, so L004, let me just say that we worked closely with the psychiatrists and the pediatricians, and the amendments that we're bringing today are in response to this conversation that we've been having with them. We are moving L004, which increases the number of hours that must be completed in a prescribing psychologist's practicum from 480 hours to 750 hours. That mirrors what APRNs are required to complete. We are also requiring that 250 hours of the practicum period must be under a specialty provider if you are working with a specialty population. So it would be, if you're working in pediatrics, you have to do your practicum hours, at least 250 of those in pediatrics. We removed the conditional prescribing period because we're enhancing the number of hours for the practicum. And it requires that psychologists applying to become prescribing psychologists must undergo a peer review process set by the Board of Psychology with approval from the Board of Medicine. We removed language that at the request of the pharmacists so they can print labels in the same way they do for other prescribers. And that's the discussion for L004. I ask for a yes vote.
Is there any discussion on L004? Representative Bottoms. Representative Holtorf.
You can leave it up there, it's okay. Thank you, Madam Chair. Thank you, esteemed colleagues. This was a very difficult bill that Public Health handled, and the amendments that are being brought forth are trying to help make the bill better. In a very complex puzzle of healthcare, of psychological healthcare, and who can administer those psychotropic drugs. This is a big change from what we do in Colorado right now. And there's a couple things that I've been asked to highlight with respect to this amendment that I believe this body needs to hear as we vote collectively in this chamber on this change. The first thing I want to point out is a lot of work needs to be done in the space of these medical complexities, and I don't know if enough analysis has been done, particularly with respect to the certifying medical boards and how those will have oversight over the administration of the program, where psychologists now are going to have the ability to prescribe these psychotropic drugs for mental and behavioral health issues. The question here is, does this amendment go far enough to make sure adequate training and education is in place to keep the highest levels of quality of care? I will tell you that there's a special concern with respect to pregnant women. Physicians and psychiatrists are arguing that there should be a full exclusion for pregnant women based on those conditions. This amendment doesn't address that directly, and that doesn't mean it couldn't be addressed as a substitute amendment or a future amendment, or it couldn't be addressed in the upper chamber. But we know that during pregnancy there's a lot of complexities and imbalances in mental and behavioral health, especially if there's complications in pregnancy. That makes this situation even more difficult to manage. I will also like to state there are some considerations with respect to the pediatric population and pediatric medical providers. We talked about the concept of continuum of care, of a care team who collaborate and work together in the medical community, comprised of a lot of different people, and how, particularly with respect to the supervising and collaboration, how that's addressed. So with respect to this amendment, I felt obligated that as the ranking member in this committee, hearing the very difficult sides of each issue with respect to this, that it was important that these particular points were brought out before this entire body, so everyone was made aware of these concerns that come from the, specifically from the psychiatric and psychiatrists and also the physicians community. Thank you, Madam Chair, for allowing me to explain these things with regard to this amendment.
Thank you, Representative Holtorf. Any further discussion? Representative Bottoms.
Thank you, Madam Chair. I do have an amendment to the amendment, a supplemental that I'd like to see displayed. I move Amendment L010.
Amendment L010 has been moved and is properly displayed to the amendment. Representative Bottoms.
Thank you. I'm struggling a lot with this entire bill on a lot of different levels. Having worked with mental health for over 30 years, there's a lot of problems with this bill. If you'll notice in your sheet that tells you who supports and who opposes, look at the different people that are opposing this bill. American Academy of Pediatrics, that's where my amendment rests strongly with. Colorado Chapter of College Emergency Physicians, Colorado Chapter College of Emergency Physicians, again, have a strong opposition to this. Colorado Medical Society has strong opposition. Colorado Psychiatric Society, it was mentioned earlier that both psychologists and psychiatrists were had discussion on this bill. It does not say that the psychiatrist approved it.
Representative Bottoms, if I could just direct you to discuss the amendment, and then I'll have time for you to discuss the bill later on. But just to the amendment, please.
The amendment itself is saying that these drugs by psychologists that don't have the same training as psychiatrists, They're getting additional training that they will not have the ability to prescribe medication to a person under the age of 18. This is specifically because it is such a unknown field in a lot of places, and that these psychologists do not have this training. If they had this training, they would be psychiatrists. And we're already going down a pretty broad road with this. And so we need to limit this to people that are adults. While I still disagree with the bill, even under those circumstances, at least let's try to do something for the safety of our kids. This is way outside the pale when we're just blankly taking off the controls that used to be on psychologists for specific reasons, because they don't have the training for this. They don't have the background for the medication side, maybe the mental health side, but they don't for the training side, and the psychiatrists are against this. Psychologists are definitely in favor for it because it broadens their horizon and broadens their financial horizon. They're going to make a lot more money for this, but they are not trained. Even with all these additions to 004 that gives them more training, they're still not even close to having the training they need for even basic psychotropic drugs. And I think any person in this room that has dealt with these as an adult, dealt with psychotropic drugs personally, you know how difficult it is, even as an adult, to figure out these balances, these chemical balances within our mind and within our bodies. And then for this, just to make this, just take off all constraints and make this available for kids, I think is extremely dangerous. So I move again for L010 to be adopted.
Any further discussion? Representative Amabile.
Thank you, Madam Chair. We would strongly ask for a no vote on this. Many other states are using prescribing psychologists to treat all patients, and there hasn't been any evidence that it's a problem. And as we said, we have been working with all the stakeholders, and we feel like the amendment we're in a good place, and we would urge a no vote.
And Representative Bradfield.
Thank you. Thank you, Madam Chair. As Representative Mobley has said, there are other states that have enacted this prescribing psychologist bill, and they have had no issues, no complaints, no malpractice. And one of the things that I think we keep missing when we're reading this bill is that there is a level of medication that will be approved for psychologists, but not to the highest level of medicines, which would be narcotics and opioids. There is in this bill an extensive amount of time if you do want to specialize with pediatrics or geriatrics, that asks the psychologist to do additional practicum in those areas. That's additional. So we feel that we have addressed many of the issues that have been brought up by the other medical associations and have satisfied many of their concerns. I urge a no vote on this amendment. Thank you.
Representative Bottoms.
Thank you, Madam Chair. Again, I want to bring attention to the fact that if you look at the list of people that are opposing this, there's two basic groups of people that are opposing this, and supporting and opposing. The supporting groups are the in-the-office people that are predominantly in the field of psychology. The people that are opposing this, look down through the list, emergency groups, there is even radiological societies. These are the people that are in the trenches every single day. They're dealing with these people, children and adults alike, that are coming in. To say that a psychotropic drug is not high level that's extremely misleading. I think everybody here knows that's not true. If you've ever dealt with psychotropic drugs personally or with other people, these are off the charts in their reactions and how different people react to these things. They're changing the chemical balance within the human brain. This should not be done. This should not be allowed for psychologists to do this carte blanche with these kids. This extra training that they get does not come close to what a psychiatrist gets. That we're talking about our kids here. We're talking about children that are going to be taking this. Look at the people that are in the trenches every day dealing with the fallout of this, not sitting in safe offices, but looking at the people that are dealing with the fallout of this every single day, and they oppose this strongly. And even if another state thinks this is a good idea, I will quote our governor, "We are not California, we are Colorado. Let's do what's best for our children in Colorado at this particular moment." I strongly oppose this amendment, and I would strongly suggest that you vote for 010. Thank you.
Representative Gonzalez Gutierrez.
Thank you, Madam Chair. Members, I want to debunk some of the things that we're hearing right now. I've worked with kids for nearly 20 years in the child welfare and juvenile justice systems. And as a social caseworker, oftentimes, more often than not, the children I worked with were in therapy, right, with a clinician, with a psychologist. They were also oftentimes prescribed psychotropic medications where they were needing to see a psychiatrist in order to access that medication. When you are working with a vulnerable population like foster children, there's a lot of appointments that kids have to go to. And so sometimes that was, a weekly therapy appointment, and then on top of that, an additional at least monthly, sometimes every other month appointment with a psychiatrist, which that appointment would literally be a 15 to 20 minute appointment. Whereas they are seeing their clinician on a weekly basis for at least an hour. That person has more contact with the child, understanding what is going on with them, how the medications might be impacting them and affecting them. So what I'm up here to say is that I'm in opposition to this amendment, and I would ask that everyone also vote no, because this bill, with continuing to be able to serve children under this bill, without this amendment, is incredibly important to making sure that kids are getting what they need when they need it.
Representative Amabile.
Thank you, Madam Chair. So someone asked us, does this allow kids to be prescribed psychiatric medications without parental consent? And the answer is no. The age of consent is 18, and this bill does nothing to change that. You will need parental consent to get prescribed these medications. Again, we urge a no vote on this amendment.
Any further discussion on Amendment L10? Seeing none, the question before us is the passage of Amendment L10. All those in favor say aye. Those opposed, no. No. The noes have it. Amendment L10 is lost. Any further discussion? Representative Amabile.
Go. Okay, you want me to go? Yep.
Thank you, Madam Chair. I'd next like to present Amendment L006 and ask that it be displayed. Oh, no,
We have to pass it.
Didn't we just do
All right, the question before us is the passage of Amendment L004. All those in favor say aye. Those opposed, no. The ayes have it. Amendment L004 passes. Representative Bradfield.
Thank you, Madam Chair. I would like to move Amendment L006 and have it displayed.
Amendment L006 is properly displayed to the amendment. Representative Bradfield.
Thank you. Thank you, Madam Chair. Amendment L006 comes from extensive conversations with the various medical groups, and here are the important things to know from that amendment. It includes several requested changes from DORA. Specifically, we are keeping the Board of Psychology at 7 members and replacing an existing member with a prescribing psychologist. Another change is clarifying the continuing education is now 40 hours every 2 years instead of 20 hours every year. So it is on the same cycle as psychologists currently required. It ensures that the Colorado Medical Board reviews complaints against the prescribing psychologists and makes recommendations to the Board of Psychology regarding disciplinary action that should be taken. I urge an aye vote.
Any further discussion? Representative Holtorf.
Just leave it. Thank you. I'll be right back.
Thank you, Madam Chair. I want to thank the bill sponsors for offering so many amendments today. They have done a very good job of working with many concerned interests. I'm proud of both of my colleagues for being concerned, for listening, and actually bringing forth second reading amendments that make a difference. So thank you to both Representative Bradfield and Representative Amable. You see, ladies and gentlemen, and for those of you in the audience, this is an example of good legislative discourse, debate, and discussion. This is how the system's supposed to work. Now, as the ranking member in this committee, there are some things that just a few comments here that I want to bring up that are still remaining concerns. The one concern is about the Board of Medicine that really sets medical standards of care. It is believed by certain parties that there needs to be more cross-collaboration between the medical and the psychological boards to fill this new role for prescribing psychologists. I believe that can come and will come as this develops here at the state capitol. But I did have the obligation, I felt, and I was asked by parties that were listed by a previous representative here that had concerns that these get mentioned on this House floor, and I think it's important that they are mentioned. So I bring these forth, Madam Chair, just as a point of concern, and the fact that we do need to highlight those boards, who sits on the boards, and how we address this new model of psychological care that we're moving towards under this legislation.
Representative Amable.
Thank you to my colleague, and that is exactly what we're doing, and we ask for a yes vote on this amendment.
Any further discussion? Seeing none, the question before us is the passage of Amendment L006. All those in favor say aye. Aye. Those opposed, no. The ayes have it. Amendment L006 passes. Representative Bradfield.
Thank you, Madam Chair. I would like to move Amendment 007 and have it displayed, please.
Okay, you've got my stack. I have yours. We switch sides.
Okay.
Amendment L007 has been moved and is properly displayed. Representative Bradfield.
Thank you. This amendment simply says a compromise with the other medical associations and requires a prescribing psychologist to disclose to their patients that they are not medical doctors. I ask for an aye vote.
Any further discussion? Seeing none, the question before us is the passage of Amendment L007. All those in favor say aye.
Aye.
Those opposed, no. The ayes have it. Amendment L007 passes. Representative Amable.
Thank you, Madam Chair. So there was one additional amendment that we were going to bring today, but the people who we've been working with, the stakeholders, were not quite ready to bring us a detailed idea about what they wanted. And so we are going to continue to work on that, and we have the commitment of Senate President Fenberg that he will collaborate with them on the collaboration agreement. It is a significant change, and we want to make sure we get that right. So now we would like to talk about the bill.
To the bill, Representative Bradfield.
Thank you, Madam Chair. This bill is one way we can utilize existing highly trained mental health professionals to help combat severe access to care issues that we face. I would like to say just a couple of things. First of all, there is no arm twisting in this bill. If you are a psychologist and you would like to have the ability to prescribe, that you are also then willing to undergo rigorous education and standards of expectations before that is before you are able to do that. Upon adoption of the amendments today, here are the steps it will take to become a prescribing psychologist, just to review. First, you need to obtain either a PhD or a Psych D from an accredited psychology doctoral program, a 4 to 6 year process, including 1,500 pre-doctoral internship.
Okay.
Representative Amable.
You have to complete a 1,500 hours of postdoctoral clinic fellowship for a minimum of 12 months. You have to pass required state and national exams, and you have to hold a current psychology license plus 40 hours of continuing education every 2 years.
Representative Bradfield.
Thank you. So once a psychologist has completed this, all of these steps, and then desires to have a prescribing license, they must do these things in addition. Go back to school. Obtain a 2 years master's degree in clinical psychopharmacology from an APA designated program. Pass the required national examination. Complete one-to-one preceptorship similar to a practicum or clinical rotations of 750 hours or more, where they will see at least diverse 150 patients populations. Also, if a psychologist wants to work with kids or the geriatric population, an additional 250 hours of their practicum must be with either a pediatric or a geriatric provider. Excuse me, I misspoke. Of the 750 hours, if you want to do a pediatric or a geriatric specialty, 250 hours of that practicum will have to be in that specialty that you want to work with. You need to pass an independent peer review by the State Board of Psychologists and the Colorado Medical Board. You have to complete the independent prescriptive license application. Take the last one.
Okay.
Representative Amable.
Thank you. You have to, after you've gotten your prescriptive license, the psychologist will need to maintain their psychology license, hold malpractice insurance, collaborate with the patient's primary care provider, and complete an additional 40 hours of continuing education relevant to psychopharmacology every 2 years. So let me just say, we have given you the how this thing works, and now I would like to just talk for 1 second about why. Why are we asking for this? And I think many of you know, and the rest of you are going to know, to the extent anybody's listening, that I have a son who has serious mental illness. He's 30 years old. We've spent the last 12 years navigating a completely broken mental health care system. One of the places that's broken is access to care. My son he was told he needed to wait 8 weeks for his first psychiatric appointment. During that 8 weeks, he went to his primary care doctor, was prescribed the wrong medication because they did not know what his diagnosis was, and ended up in the hospital. And since then, it has been an incredible struggle, but not just for my family, for thousands of families in Colorado. This process is convoluted, it's too long, it's too expensive, and so we have families all over the state that cannot get care for their loved ones in the time frame that they need it. So the bill does really 3 things. It allows a prescribing psychologist to treat the whole person, to treat you with therapy, with CBT, DBT, whatever it is you need. And if you need it, they can prescribe a medication. And if you're on a medication and you don't need it, you no longer need it, they can also take you off of that medication. You go to one practitioner and they will know a lot about you. The way we have it set up right now, you go to your therapist and then they tell you, okay, now you need to go to a psychiatrist. And the psychiatry appointment might be 6 weeks, 8 weeks, 10 weeks out. And you have to pay twice, because you have to pay to see the therapist, and then you have to go and pay to see the provider. So this is inconvenient, to say the least, but it also isn't good care. And that's why we're bringing the bill. It is really about the patients. It is about the people in Colorado who need access to care. So I would urge a yes vote on this bill.
Is there any further discussion? Representative Luck.
Thank you, Madam Chair. I reached out to a few folks who operate in this space, and one of them recalled having practiced years ago and understanding that California allowed for this practice, that psychologists could prescribe. But I know on the fact sheet that we got that California isn't a highlighted state. And so I'm just wondering if you all know whether California did indeed have this practice previously, and if so, why did they change their law? Thank you.
Representative Amabile.
Thank you for the question, and thank you, Madam Chair. No, there are 5 states that offer this, that allow psychologists to prescribe. California is not one of them. The states are?
Representative Bradfield.
Thank you, Madam Chair. The states are New Mexico, Louisiana, Iowa, Illinois, and Idaho, plus the Department of Defense.
Representative Luck.
Thank you, Madam Chair, and I appreciate that. I think you all were chatting while I was asking my question. So my question actually goes back to when I reached out to some folks who practice in this area. One of them recalls early on in her career that California did allow for this years ago for psychologists to prescribe, and I noticed that it's not on the fact sheet as one of the highlighted states that now allows for it. So I'm wondering if you all know if indeed that is true, that at one point California did allow for this policy, and if so, why did they change their rules?
Representative Amabile.
To my knowledge, no, but it could have been many years ago, and I don't have any information on that, but the answer is no. New Mexico has been doing this for 20 years. They've had very few, they have less complaints than complaints against psychiatrists. There have been less legal action, and there have been less, just less than psychiatrists in terms of malpractice claims. And the military has been doing it for 30 years or more.
Representative Soper.
Thank you, Madam Chair. I just wanted to say, I appreciate what the sponsors have done with this bill. We've heard a lot of scope of practice bills throughout the 5 years that I've served in this chamber. And I believe this is one that definitely includes the safeguards to ensure that if we are going to expand scope, that it's an appropriate measured a job that has been done here. The requirements that were just laid out, those are great requirements. What I would encourage, though, is continued talk between the psychiatrists and the psychologists, because I do think it's important that as we're moving in this direction, that we've continued to have those conversations and know that at least both sides feel comfortable. So that's the one thing I just would advocate. But overall, I support this. I actually, in reading the bill, it's my own opinion that I think very few would ever be able to have prescribing authority under this bill. I think the safeguards are so onerous that we're probably talking less than 24 individual psychologists would be able to have prescribing authority under this bill. And that's fine. This just gives a path to the people that are the best of the best. And I appreciate that for rural Colorado and for being able to remove barriers to accessing specialists. Thank you.
Representative Byrd.
Thank you, Madam Chair. And I also would like to thank the sponsors. I applaud their work. I know this is a difficult topic. Scope of practice changes are not easy conversations to have under the Golden Dome. So definitely want to extend a lot of gratitude. And I agree with the merits. I think what you're trying to do is the right thing. We need to definitely be expanding patients' access to care. What I'll highlight, and I know there are ongoing efforts to this, though, that as we expand access to care, in no way are we lowering the bar, reducing quality. So there's always a balance to be had, that as we expand access, that we are maintaining quality care. And one thing that I'm hopeful that our bill sponsors continue working on, especially in the Senate, is more with respect to training. I know that right now the bill, as amended, provides for 750 hours of additional prescribing training. And I do understand that even nurse practitioners, psychiatrists, pediatricians are receiving between 12,000 and, in some cases, 60,000 hours of training and practice in this area before they're given the authority and licensing capacity to prescribe medications. So I'm hopeful that there's conversations in this regard. Make sure that the other piece I'm worried about, and I'm certain, again, this is being worked on, but none of the 5 prescribing schools or schools that train prescribing psychologists have specialty areas in the fields of pediatrics, geriatrics, and obstetrics. So hopeful that there's focus there, and look forward to seeing changes so I can be in a place to support the bill.
Representative Bottoms.
So, thank you, Madam Chair. So again, a few things with this bill. Children already have access to psychotropic drugs. This is done through trained psychiatrists that have the medical knowledge to be able to assert this. This bill is taking all controls off of everything. I'm strongly against this bill on so many levels, but specifically, again, for children. We just heard that this cannot be done without parental consent. That is extremely not true. It's not only true, disagreed with in the CRS. Yesterday, in committee, it was passed to come to this body that mental health people in schools, counselors can refer children without parental consent to get this mental help, which can include psychologists, which can include psychiatrists. So that is not true. If you're voting thinking that parental consent will be available here, it will not be available. That was just discussed yesterday, and it will come to this floor and it will be passed that children can go without parental consent to get this. Dr. Paul Applebaum, former president of the American Psychiatric Association. So this is the biggest body that would address this subject right now. He said medications used to treat these disorders can affect the functioning of other organ systems, especially when those organs are already compromised by illness, and interact with medications prescribed for other medical conditions. We see where this is happening all the times. We're prescribing 2 or 3 different drugs. They're all disagreeing with each other. Now we have less qualified people making these decisions. He says, Dr. Applebaum says, to pretend that a few months of training regarding the brain and psychoactive medications can render a psychologist fit to prescribe drugs that can affect the entire body and to monitor their impact is to belie the intricacies of human psychology. I strongly urge you to vote against this bill.
Representative Michael Saint-Genet.
Thank you, Madam Chair, and thank you to the bill sponsors for bringing this bill. I just wanted to clarify something on age of consent. It is absolutely the law that you cannot get medication under the age of 18 without parental consent. It is absolutely 100% the law.
Any further discussion? Representative Bradley.
Thank you, Madam Chair. In committee, I was through a lot of trepidation because I do not like to expand the scope of practice as a healthcare worker. Had a lot of questions. Rep. Amabile and Bradfield both answered my questions. I was still teetering this morning on the fact that I don't like parental rights being stripped. I don't like parents not knowing what is happening to their children. So I'm going to offer an amendment that I've talked to both of them about. It's L011. It's a prescribing psychologist should not prescribe any drug to a person under 18 years of age without informed consent from the parent or guardian of such person.
Representative Bradley, can you please move your amendment?
I move this amendment. L001. L011. Freshman legislator here. Thank you.
One more time all together.
I vote to move amendment L011.
Great. Thank you.
Hey, wait a second. She said thank you.
An amendment L011 is properly displayed.
Back off.
Representative Bradley, to the amendment. Please explain your amendment.
Oh, now I'm explaining it? Okay, I'll explain it again for those in the back. A prescribing psychologist should not prescribe any drug to a person under 18 years of age without informed consent from the parent or guardian of such person.
Thank you.
Curtsy.
Representative Bradfield.
Thank you, Madam Chair. Representative Mobley and I do have no reservations about this amendment, and we ask for an aye vote.
Is there any for Representative Amabile?
Yeah, I urge a yes vote on this amendment. Thank you.
Is there any further discussion on Amendment L011? Seeing none, the question before us is the passage of Amendment L011. All those in favor say aye. Aye. Those opposed, no. The ayes have it. Amendment L011 passes. To the bill. Any further discussion on House Bill 1071? Seeing none, the question before us is the passage of House Bill 1071. All those in Representative Luck.
Thank you, Madam Chair. So just pulling up some data on this, I'm seeing that New Mexico, which was raised as the example for this policy, has double the suicide rate of the national average. Is there any connection there? Can we speak into how this is being the case if this policy is supposed to help to minimize the mental health needs?
Okay. Any further discussion? Seeing none, the question before us is the passage of House Bill 1071. All those in favor say aye. Aye. Those opposed, no. The ayes have it. House Bill 1071 passes. No. Mr. Shebel, please read the title of House Bill 1064.
House Bill 1064 by Representatives Lukens and Young, also Senator Marchman, concerning the enactment of the Interstate Teacher Mobility Compact.
Representative Lukens.
Thank you, Madam Chair. We move House Bill 231064.
To the bill.
House Bill 1064 is an interstate teacher mobility compact. This is an interstate licensure compact that is legally binding, legislatively enactive, and constitutionally authorized agreement amongst the states. This particular mobility compact is in regards to teachers and their ability to overcome barriers and state licensure requirements. We have a teacher shortage, an educator shortage in the state of Colorado, and this bill will support high-quality teachers to move to Colorado, and therefore this bill supports a high-quality education system which benefits our students.
Representative Young.
Madam Chair, it is a pleasure to serve with you.
Pleasure to serve with you as well.
Thank you. I want to talk a little bit about how this bill came to be. It happened, this Interstate Teacher Mobility Compact bill was initiated by the Department of Defense in concert with the Council of State Governments and the National Association of State Directors of Teacher Education Certification in order to make it easier for teachers, especially the spouses of active military members, obtain a license to teach in compact member states. Our state is a member of a number of compact bills that have allowed professionals such as nurses, counselors, and others to easily obtain a license here in Colorado. This compact bill is different from other compact bills, recognizing the unique nature of teacher licensing. To be eligible for a license in the compact, the teacher must meet a set of criteria outlined in the legislation. To be eligible for a license must require a bachelor's degree and a completion of a state-approved program for teacher licensure, like a teacher preparation program at a college or university. In addition, for a license to be eligible under the compact, it must be unencumbered, not restricted, probationary, provisional, substitute, or temporary. We do have a carve-out for military spouses. Since they are so mobile, they often do not have a regular license, so they can receive a license if they have a provisional or temporary license. This allows teachers to get a license without submitting additional materials, sending transcripts, taking state-specific exams, or completing additional coursework. It allows the state to keep control over licensing. The language in the bill includes licensure for the full spectrum of teachers, P through 12, general education, special education, etc. I want to say that right now in DC, they are considering whether Colorado should be the Space Command Center for the United States. And as we know, it should be in Colorado. And one of the factors that they look at in evaluating whether a state is really ready to provide it is their participation in compact bills, because it meets the needs of military spouses. I urge and I vote.
Representative Pugliese.
Thank you, Madam Chair. Thank you to the bill sponsors for bringing this forward. I had a real struggle in committee on this one. I absolutely agree there's a teacher shortage. I absolutely agree that there's a solution. The one thing I want to bring up is that I did have a conversation with Colorado Department of Education yesterday, and they said 99% of the applications to transfer a license in Colorado are granted. 1% of those that are not granted are because they either don't meet the background check or they come from non-accredited training programs, which, if we want to maintain our high standards of high quality teachers, this doesn't meet our requirements. What they said, so I asked what is holding up the process, because it is taking about 3 to 6 months, and they said it's CBI and the background checks was one of the issues. And so I think we do need to have a broader conversation about how in the interim, before this compact potentially comes into place, we can address those issues to address our teacher shortage here in Colorado by Coloradans in the nearer future. Thank you.
Representative Winter. Sorry, Wilson.
Thank you, Madam Chair. I move Amendment L004.
L004 has been moved and is properly displayed. Please explain your amendment.
This amendment is just a sunset amendment to the bill. We should not be tying further or future legislators to legislation that may just be sitting around doing nothing for years to come.
Assistant Minority Leader Puglisi.
Thank you, Madam Chair. So the way the compact works is there needs to be 10 states in the compact in order for the compact to come into fruition. Right now, there are less than 10 states considering it this legislative session. And so even if, I believe there was some question as to whether it was 7 or 9, but regardless, it's under 10. So even if every single one of those states say, yes, we're going to join the compact still cannot come into effect until 10 states are in the compact. So you're looking at least a year. Then when you actually get all 10 states, then you've got to actually convene those compact states to start having these conversations. It's just a process. And, I particularly don't care for compacts, but that's not the issue. The issue is it's going to take a while before this is in place, and so we just want to make sure it doesn't extend indefinitely.
Representative Wilson.
And for that reason, I ask for an aye vote on Amendment 004.
Representative Young.
Thank you, Madam Chair. Representative Lukens and I appreciate the sponsors of this amendment bringing it us to this morning. Unfortunately, with a compact, you cannot amend it easily, because if you amend it, it may violate the compact, which is what we shared with the sponsors of this amendment. We are in consultation with the groups that, the legal consult with the groups that have brought this forward, the Department of Defense, CSG, and the Accrediting Teachers Association. And we heard about this amendment this morning. We have not heard back. So we cannot support this amendment at this time. So I urge a no vote. We're certainly interested if we get clearance from legal counsel, perhaps it moving ahead in the Senate. Thank you.
Representative Soper.
Well, thank you, Madam Chair, and I appreciate the kind words from my colleague from up north on this side of the Continental Divide. I do speak in favor of the amendment, though. We've seen different compacts over the years, and I've been very sensitive to the fact that you can't amend the substance of the compact if you want the compact to go into force. That being said, this amendment has an automatic repeal on it to say that if the compact doesn't come into fruition by June 30th of 2026, then the entire section of statute is struck out. And that's really important for maintaining budgets. It's really important for having expectations. It's important for not necessarily binding the legislature of the future, because that's a short enough period of time out that most of us in this chamber will still be serving as well. So those are all great arguments for being able to have some sort of an automatic repeal. So I appreciate the sponsors sharing it with your legal counsel and being able to dive into it. I understand why we may not be able to get there right at this moment, but I would like to encourage those conversations to continue, because this shouldn't jeopardize the ability of the compact to come into force if it does so before this particular date. So I'd ask for a yes vote. Thank you.
Any further discussion on Amendment L004? Seeing none, the question before us is the passage of Amendment L004. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. Amendment L004 is lost. To the bill. Any further discussion on House Bill 1064? Representative DeGraff.
Thank you, Madam Chair. It is a privilege to serve with you. Let's see. As a military
Pleasure
veteran,
to serve with you as well.
thank you. As a military veteran of about 27 or 30 years, depending on how you count that, and moving about 20 times and about in several different countries, I am very familiar with the issues that spouses have in terms of this. And in fact, my wife is not able to practice in Colorado because of a licensure issue. Now that was passed here. One thing that I'd like to note is that this compact is binding, as noted by our colleague, and it's. But when you read the bill, this seeks to establish, this plans to create a stream pathway, and let's see. The other one was. Promulgate uniform rules to implement and administer this interstate compact, and this shall be binding. So this is really putting into place a compact that has not been written yet. So as a military member, I know that yes, this could be an issue, but also that there is possibly a lot of problems that are written in this that we don't even know yet because it's not even written. So we don't know what's going to come out of this. We don't know whether it's going to be beneficial to the service member, especially. We don't know any of these things. This is not only a blank check. This is a blank statute. This is asking to assign a group of people and put them in charge of creating laws, interstate laws that will be binding for us. So I would, just because this is, I think in terms of ancient wisdom, this would be called something like a Pandora's box. And we should vote no on it and revisit it when the compact is made. At some point, the drafters can bring us a compact and we can decide whether that's something that we want in law and not bypass the legislative authority of this body. Thank you. I strongly vote no
Representative
from a military
McLaughlin.
perspective.
Thank you. I'm in strong support of this bill. Teacher shortage in Colorado is at a critical point. This gets people in here who want to be here. They're certified. The state gets to say who passes the threshold and who doesn't. It's not just everybody is welcome. If there are stipulations they need to follow, they will have to do that in Colorado. We want teachers, we want them to come. We want military spouses to feel like they are welcome in Colorado. There's so much that this bill does for Colorado, and I strongly urge an aye vote. Thank you.
Representative Wilson.
Thank you, Madam Chair. I recommend a no vote on this bill. The reason being is it does not do anything for the teacher shortage. In fact, with the states that are considering the compact, the majority of them have lower cost of living than Colorado. So it would actually be profitable to a teacher to go to one of these states instead of working right here in Colorado. This bill has a lot of unknowns in it. It has an unknown timeline. As mentioned earlier, there's only 7 states even considering it. It doesn't go in effect till 10 states sign on to it, which could be 10 years from now. The bill also has an unknown future cost. It is hard to plan a budget for a compact when you don't know what the compact fees membership will cost or what kind of staffing it'll cost. And like I mentioned, the bill has unknown results. We could possibly, in this program, we could possibly get 1 teacher while we lose multiple other teachers. This bill also puts our teaching standards at risk. Because we would only be 1 vote in 10 states, their vote would supersede us if they wanted to lower our teaching standards. If you notice, the majority of stakeholders on this bill are only monitoring. The reason being is that the bill has so many unknowns that it's hard to take a position on. So with that, I ask you for a no vote on this bill.
Representative DeGraff.
Thank you, Madam Chair. And just to continue, our colleague stated that this would solve the teacher shortage, and I would contend that we don't know if this would solve a teacher shortage because we don't know what this compact is. We don't know what the fees are. We don't know what the laws are. We don't know what the rules are. We really don't know anything other than that this is a bill full of good intentions and potentially good intentions. We'll just assume they're good intentions, and we don't know what the actual impact will be. This body should evaluate the compact when it is brought to us. That compact is being written. That compact is being finalized. When those 10 states have a draft of what they want the compact to be, the proper format would be to bring it to this body. And then we can have the debate as to whether it is a viable compact or not, or whether it creates more problems than it intends to solve. So just like every day is a good day to save the world from good intentions, and I recommend a no vote on this bill.
Representative Lukens. Representative Holtorf.
Thank you, Madam Chair. I appreciate your leadership.
Thank you. Please
I
continue.
will tell you that in rural Colorado, we have a real big problem with teacher shortages and getting enough teachers. It is my opinion that anything we can do to help rural Colorado get teachers in our rural schools is so important. For many of you in this chamber, in your districts, you might have 1 or 2 or 3 schools in one school district. In rural Colorado, you have 2 or 3 or 4 or 5 or 6 or 10 or 12 school districts. And sometimes in those school districts, you have 1 or 2 or 3 small country schools and small town schools. Here is our challenge, and I hate to speak of the rural-urban divide, but I feel compelled to just briefly talk about this. Those little schools have to have the same administration that the big schools have to have, and every one of them need that staff. Plus, we need the teachers to teach K through 12. The classrooms are small in numbers, but every class has to have a teacher. So I just want to say that I'm supportive of anything we can do to get more teachers in Colorado to help rural Colorado and our rural schools. Thank you.
Representative Lukens.
Thank you, Madam Chair. Thank you, members. We urge a yes vote on House Bill 1064.
Any further discussion on House Bill 1064? Seeing none, the question before us is the passage of House Bill 1064. All those in favor say aye. Aye. Those opposed, no. The ayes have it. House Bill 1064 passes. Mr. Shebel, please read the title of the House Bill 1101.
House Bill 1101 by Representatives Vigil and Bacon, also Senator Winter F., concerning support for transit and in connection therewith, increasing the flexibility of the Ozone Season Transit Grant Program and increasing opportunities for transit agency participation in regional transportation planning.
Representative Vigil.
Thank you, Madam Chair. I move House Bill 1101 on second reading and also the House Energy and Environment Committee report.
To the committee report.
Thank you, Madam Chair. We had a couple of amendments come up in energy and environment. Mostly these were just some tools requested of us by the transit agencies. One is to repeal the sunset on a mill levy authority that they have, and also to increase the allowance, the amount they are allowed to request from the voters from 1 mil to 2, just to allow them some more financial flexibility when it comes to going to the voters for requests for public transit funding. And I urge an aye vote.
Thank you. Representative Evans.
Thank you, Madam Chair. I move Amendment L003 to the committee report. And so,
Amendment L003 has been moved and is properly displayed. Representative Evans.
thank you, Madam Chair. So what this amendment does, initially, I honestly didn't have a whole lot of opposition to the bill. However, one of the adjustments that was made in committee would increase the authority of transportation districts to ask for more tax. Currently, they are capped at 1% that they can ask for, and under this, they would be allowed to ask for 2% tax. At this point, given that we have record high inflation, record high cost of living, record high cost for a dozen eggs, a gallon of gas is $4 for a gallon of gas. This does not seem to be the appropriate time to be asking for more taxes. Now, I understand that this is not actually a tax increase. This is just asking the voters for a tax increase. But something that I learned in the military and law enforcement popped into my head, and that is that people should be leading by example. All through COVID, we heard the refrain over and over and over again that, hey, we're all in this together. And the fact of the matter is, right now, low-income Coloradans, people on fixed income, are struggling just to make their ends meet. We hear on a daily basis about how the cost of living is too high, the cost of housing is too high, the cost of everything in our society is too high. And so in order to lead by example, to show that, look, when everybody else is tightening their belts in order to make ends meet, we also need to be doing the same. We need to be finding the same ways to do more with less. And so the mere ask to grant that authority to go to the voters and say, hey, 1% sales tax is not enough. Now we want to have 2% sale tax. The timing of that seems completely wrong to me. The optics of that seems wrong to me. That seems to violate that principle of leading by example. If everyone else is tightening their belts, we need to be tightening our belts too. The timing is wrong to be asking for a 1% sales tax increase. That is what this amendment does, and so I would urge an aye vote on L003 in order to keep the sales tax authority where it currently is.
Assistant Majority Leader Bacon.
Yes, and I'd like to thank Representative Evans for his thoughtfulness. The amendment that we brought was suggested to us by the transit authorities on behalf of their communities. Current statute reads that they have the ability to ask the voters. So first they have to actually put something on the ballot that if they'd like to increase revenues from use tax, instead of going up to 1%, they can go up to 2%. So we agreed to this because we know, as part of this bill is about, that people are slowly reconnecting to transit, and communities want to have the ability to provide better routes, better services, but it is still entirely up to the community if they'd like to approve those funds. So we are not changing that. We won't automatically increase use taxes. We're just saying if a transit authority would like to put that on the ballot, they can go up to 2%, but it's still up to the people in the community to decide if they're going to do that through proper vote, courtesy of Tabor. So we would respectfully ask a no vote on this amendment.
Any further discussion on Amendment L003? Seeing none, the question before us is the passage of Amendment L003. All those in favor say aye. Those opposed, no. The noes have it. Amendment L003 loses. Back to the committee report. Assistant Majority Leader Bacon.
Thank you. We urge an aye vote on the committee report.
Any further discussion on the committee report? Seeing none, the passage before us is the question before us is the passage of the Energy and Environment Committee report. All those in favor say aye. Aye. Those opposed, no. The ayes have it. The Energy and Environment Committee report passes. To the bill, Representative Vigil.
Thank you, Madam Chair. I'm really pleased to bring this bill before you, members, and ask for your yes vote. The Ozone Season Transit Grant Program Fund that's been created, just to be clear, this bill does not expand that program or add to that program. It's funded, there's no new appropriations, and we haven't extended the life cycle of it in any way. What this bill really spoke to is that the transit agencies that experienced such great success with the program in its first year last summer found some ways that we could improve it and make it more flexible and more adaptable to local needs, and overall make sure that its success is greater in the coming years based on their needs. And that includes things like altering the timeline so that it doesn't have to be during the summer if that's not when a certain transit agency's peak ozone season is, allowing them to use some of those funds for outreach to actually bring in transit curious folks. And again, with the funding mechanism, just to make this whole program more successful for them. So I urge an aye vote. We need to be acting on our ozone threat, and we can improve public transportation and create more options for Coloradans and save them a lot of money while we're at it.
Assistant Majority Leader Bacon.
Thank you, members. I'd also like to just share with folks the crux of this bill is to adjust an existing grant program. The money has already been appropriated for a 4-year program. If the bill doesn't pass, then the grant will only be issued in a narrow scope. So the purpose of this bill is to allow more flexibility, to allow more transit authorities and more communities across the state to access this money, to be able to provide free fare during days like ozone. I know in my district this is really important. I don't know if they're paying attention, but students from KIPP Northeast Academy could take the train over the summer downtown for free. So an additional perk of this bill is allowing people to save on transit, be introduced to public transit, to encourage people to ride, increase ridership a little bit more than getting in their cars. But people will also have the opportunity to explore different corners of our state, be able to save a few dollars on some of the toughest days that it is to breathe. And so we urge an aye vote.
Representative DeGraff.
Thank you, Madam Chair. I don't know who keeps moving this thing. Vertically challenged. All right. I think we should vote. I think you should vote for this bus/ozone bill, or what I call bozone bill for short, so I'll urge an aye vote. This program was posited to reduce ozone emissions during July and August. Ozone is produced when non-oxidized hydrocarbons react with strong summer sunlight. Some areas have their ozone season during the winter, and the shift was requested to accommodate, although that concentrate was later informed to be in regards to cattle operation, not traffic, but will help tourist transportation. Current catalytic converters knock down about 98% of emission of cars. It's already burned much cleaner due to the fuel injection to eke out every bit of possible power. Diesels have a different pollution footprint, and when asked about the anticipated benefit of the program, none of the agencies knew or even considered it. Not knowing whether the metrics were achieved or even what they might be or how to calculate them, however, is no reason not to spend another $17 million per year on a transit mode used only by about 3% of our population. Especially since the only other option would be to utilize efficient free market solutions like Lyft and Uber, picking up the aged and infirmed and veterans at their door for half the cost, and allow citizens to retain more of their earned income. One goal of these programs is to purchase more displaced emission buses at $250,000 more than a diesel with half the range and half the useful road time due to a 4-hour charge requiring a $1 million charging station. One $750,000 diesel does about the same work as $5 million of displaced emission buses. That $4.25 million difference in material, manpower, and energy is the equivalent of about 100 sedans. So a bus doesn't really remove cars from the road so much as it crams 100 of them into a very small traffic-snarling road hazard, requiring subsidization at $2 per passenger mile, many of which are not even useful miles. Normally, when you take money by force instead of an exchange of value, it is called robbery, but in this case, it's called legislation, which has effectively become a synonym. Fares cover about 13% of the cost, but not discussed is that the biggest distractor for public transit is your most valuable commodity, time, along with completely intangible things like personal space, safety, and privacy. The high tax load incurred by all of these good-intentioned programs requires increased work hours to stay afloat, never mind getting ahead. Spending at the speed of emotion is unlikely to abate, so rinse and repeat. It is somewhat ironic that our health policy still recommends social distancing, but our transportation theme is more of a sardines in a can vibe. Also, from previous environmental discussion, upwards of 70% of our pollution returns to us in karma-like fashion from other countries, as easy as 99 Luftballons toting spy gear from Red China. Much of those pollutants are likely those displaced emissions from creating our virtue-preening ZTE transit system with child labor and near-zero environmental considerations. Of course, we were told that the only problem with public transportation is a lack of participation, which seems odd given the assertion that bus transit was absolutely life-sustaining for LGBT, veterans, Americans of every other descent, and probably some endangered wildlife, and is therefore absolutely essential for transportation equity. It is amazing that there is even an open seats, but apparently there are many. I doubt lack of participation will be tolerated and will soon lead to socialization of the governor hinted schemes of centralized zoning, where properties near public transit can be subdivided for the greater good, which never is, and the great good of campaign financing developers without impacting the gated communities of our Yaris driving elite. Because we know this from the State of the State address, that cramming more people into Colorado will expand open spaces, mitigate traffic, and provide much more water for ranchers. Bottom line, no matter how inefficient public transit is, we can be confident it is the solution. With those facts, you might wonder how I could suggest an aye vote. Well, despite the demonstrated contribution that U.S. hydrocarbon consumption being less than 1/10,000th of all the energy in our atmosphere, we were categorically informed before the committee categorically declared that these lumbering mobile traffic jams rolling in the wrong direction would not only be safer and traffic calming, but the program would reduce droughts, floods, heat waves, cold snaps, arson, and invasive beetles. Since this service is only subsidized at $2 per passenger mile, the committee determined it should be expanded and was determined to allow the supporting taxation to be doubled. The program extended indefinitely and established the right or power of any regional transportation authority to continue to annually levy any prior mill levy in perpetuity. The bold steps taken by this body in granting a sacred cow, a golden calf, not only the right of life, but the right to live forever, is not to be overlooked and proves the adage of Milton Friedman that there is nothing so permanent as a temporary government program. Damn the facts, full spending ahead. It is clearly the leadership required of this body to navigate these challenging financial times. While the completely unsupported and likely counterproductive environmental impact would seem like a deal breaker, the program does avail of the use of many woke buzzwords. Plus, bloated, inefficient, and lumbering in the wrong direction is the perfect picture for our growing bureaucracy, which is why I think you should vote for it and record your vote as a yes.
Assistant Majority Leader Bacon.
Thank you, members. We just want to remind folks that we know we have a lot of issues that we need to deliberate and decide on moving forward. We have decided as a community, I think generally, that air quality is something that we want to look into. This bill, again, refers to grants that were given to us from federal dollars that will be limited over the course of 4 years. As a broader package for us to be able to think about tackling not only our air quality, but what we can do to reduce traffic, sprawl, and so forth. However, this bill is not intended to be the end-all to solving all of those problems. We know we need to have continued conversations, but we know we do have the dollars. It increased people's connection to public transit, and for what it's worth, in its first year, it worked for the purpose. And we urge an aye vote on the bill. Thank you.
Representative Evans.
Thank you, Madam Chair. So to the bill, this bill does two things. The first thing that it does is it gives greater flexibility to the transportation districts to be able to use the funding that they've already been allocated during the high ozone season. And coming from being a municipal government worker, I understand the importance of that, and I honestly don't really have much objection to that component of the bill. And if that was all that the bill was doing, then I might be taking a totally different stance up here. However, in addition to giving that flexibility to those transportation districts to use that funding according to the most appropriate timeline as they determined, and again, I have no issues with that, it also does two things with regard to raising or giving permission to raise or increase taxes. I already had touched on that permission to increase sales tax from 1% to 2%, and I understand that that goes to the voters for their approval. However, I still don't think that the ask is even appropriate given the difficult financial times that we and our communities find themselves in. The second thing that the bill does is it also allows a mill levy to continue. Currently, that mill levy had a sunset in 2029, and that mill levy in this bill is also allowed to continue indefinitely. So again, based on that principle of leading by example, tightening our belts when the rest of our communities are having to tighten their belts, I would urge a no vote on this bill, not because of the component that gives the flexibility to the transportation districts. Like I said, I don't have any concerns with that. But because of the message that it sends to our communities who are being faced with record high cost of living, that, hey, even though transportation has already been given $24 million, we want to come back and we want to ask for even more money for that. I think that is the wrong message to send, and because of that, I urge a no vote. Thank you.
Representative Vigil.
Thank you, Madam Chair. And I do just want to speak to the taxation issue here. I do want to draw a distinction between when an individual or a household tightens their belt and when a government tightens its belt. Because when we spend money on transportation out of this institution or any other, we are making an investment in the public that saves people money on their daily living. Every dollar that we spend on multimodal transportation in Colorado goes further than the money we spend endlessly paving more and more roads so that more and more people can spend more and more of their money on their private motor vehicle, plus the gas, the insurance, and the upkeep of it, so that they have the privilege of driving on that road that is only open to cars. So I would urge an aye vote. We are expanding transportation options. We are actually giving more leeway to local governments to exercise local control over their own transportation needs. I think we should all be in favor of that when it's productive. And again, I urge an aye vote.
Representative Evans.
Thank you, Madam Chair. So, to that comment, I have some concerns about the statement that it's a privilege to drive. I believe that the freedom to travel is a right that people have and not a privilege, the freedom to move around their community. Again, the second concern that I have is the data shows that currently only 3% of folks use these mass transportation services. However, they're subsidized at a rate of approximately $2 per passenger mile. So what we're really doing is we're asking a significant percentage of the population to tighten their belts despite $24 million being given to these transportation districts that only 3% of folks use. So 97% of folks are going to be subsidizing the 3% of people that are using these services. Again, I understand it's an important service. My objection is to the amount of money that is flowing to this and the fact that during these hard economic times, we are asking voters to potentially contribute even more money to this for a service that only very few people use. Thank you.
Representative Bottoms.
As was just said, we're taking taxpayer dollars to help taxpayers spend less money. Except what seems to be lost on this body in almost every bill we're passing is the fact that the taxpayer's money belongs to the taxpayer. And we're taking their money and then re-subsidizing something for them at a much tinier percent than what they originally had. Why don't we not allow the bus people to levy taxes and let's let them keep their own money, and then they can decide to walk, drive, fly, however they want. But they get to decide that, not the state of Colorado, and not the people that are pushing this, which is the transit departments. And so I think, well, let's let the people of Colorado keep their money, stop taking their money, and stop telling them how to spend it, and stop using it on buses that are subsidizing $2 per person that is riding that bus. So our taxpayer dollars from the taxpayer are making this thing more bloated every single second.
Senator Winter. Representative Winter.
Thank you, I appreciate it. Thank you, Madam Chair. I just want to say this helps Coloradans. How does this help rural Coloradans? We talk about building roads. We need road infrastructure in rural Colorado. We have to get our kids to school. We have to get our wares to market. So when we talk about all of Colorado, I understand that this may help my friends in the urban area, but at the end of the day, how does this help rural Colorado? Thank you.
Representative Holtorf.
Thank you, Madam Chair. Thank you for your leadership. A comment was made that touched me and impelled me to come down and speak. Driving your vehicle is not a privilege. Owning a vehicle is not a privilege. I will tell you, in rural Colorado, it's a necessity. And if my urban cousins don't understand that, then all of the rural legislators here would not be able to come to the Gold Dome and do our work and represent our rural constituents if we didn't have roads, good serviceable roads, and we didn't have vehicles to traverse those roads. This is not a privilege. For my urban cousins that think the only proper transportation is public transportation, I will tell you that is what builds a longer bridge between the rural-urban divide. Understand the necessity that we have. Because where I live, you have to drive 20 to 25 miles from our ranch and our homes in the country just to get a gallon of milk or a dozen eggs. And there are people that don't have the luxury of being that close. You might drive 50 to 80 miles to do the same thing. Our school buses to pick up our kids. When I rode the school bus, I was on that bus for over an hour every day, sometimes an hour to an hour and a half every day to get to school in the morning in my hometown and to get home from my school. And I was the last kid, the first kid on the bus and the last kid off the bus. Please understand, my colleagues, that roads and transportation and the right to own vehicles, and maybe more than one vehicle when a family goes in different directions, and then you have teenage kids that have driver's license and have to go and do their things, and you have multiple vehicles now to get all the things done you need to do in rural Colorado. Those are necessities, not privileges. And maybe I'm overthinking this. I'll ask the bill sponsor if I am. But I want to be very clear. Raising taxes as a fiscal conservative is always a concern. Redistribution of wealth is always a concern. Now, I understand in this bill that it's the voters' choice to raise their mill levies. And that is a key component of this. But my colleagues here are speaking some things that are very important and we need to understand, need to be considered and not spoken to as if this is some kind of privilege. Thank you, Madam Chair.
Representative DeGraff.
Thank you, Madam Chair. I'd just like to remind my colleagues that bloated, inefficient, and lumbering in the wrong direction are really the point of voting for this bill, because there's no better monument that we could build, that we could erect to the growing inefficiency of the bureaucracy that we create here every day than having a rolling advertisement snarling traffic in our streets.
Any further discussion? Seeing none, the question before us is the passage of House Bill 1101. All those in favor say aye. Aye. Those opposed, no. The ayes have it. House Bill 1101 passes. Mr. Sheevel, please read the title of House Bill 1106.
House Bill 1106 by Representatives Evans and Byrd, also Senators Kolker and Will, concerning authorizing the Board of the Fire and Police Pension Association to provide non-compounding cost of living adjustments.
Representative Evans.
Thank you, Madam Chair. I move House Bill 1045 and ask for an aye vote.
1106.
Excuse me, I'm reading my old notes. 1106 and ask for an aye vote. There is no committee report.
Is there any further discussion? Representative Byrd. Please move the bill again.
Thank you, Madam Chair. I move House Bill 1106 and ask for an aye vote.
Representative Byrd.
Okay. Thank you, Madam Chair and members. I'm so excited to be working with our colleague, Representative Evans, on a bill to give the FPPA board, that's the Fire, Police, and Pension Association, an additional tool to make sure that they can offer a meaningful benefit to their retirees without increasing their ongoing base retirement benefit costs. I urge an aye vote.
Representative Evans.
Thank you, Madam Chair. Additionally, it's important to point out that the FPPA is fully funded. They're funded at 105%. And so this bill, by allowing them to give that one-time cost of living increase, is actually a very powerful tool that we need in order to be able to retain our police and our firefighters. Having come from that industry, I know that this particular retirement package is, in fact, a big reason that people stay and perform that 20-year that career. And so by allowing this program, which again is over more than fully funded, that flexibility to give that one-time cost of living increase is both financial good sense, and it also helps us to retain our first responders. Thank you.
Is there any further discussion? Seeing none, the question before us is the passage of House Bill 1106. All those in favor say aye.
Aye.
Those opposed, no. The ayes have it. House Bill 1106 passes. Oh. Madam Majority Leader.
Thank you, Madam Chair. I move that the committee rise and report.
No objection. The committee will rise and report.
The House will come back to order. Mr. Schiebel, please read the report of the Committee of the Whole.
Madam Speaker, your Committee of the Whole begs leave to report as under consideration the following attached bills, being the second reading thereof and making the following recommendations thereon. House Bill 1064, 1071 is amended, 1101 is amended, 1106 passed on second reading and ordered, engrossed, and placed on the calendar for third reading and final passage.
Representative Doherty. The motion before us is that the House adopt the report of the Committee of the Whole. There are no amendments at the desk. Mr. Schiebel, please open the machine and members proceed to vote. Please close the machine. With 46 aye, 19 no, and 0 excused, the House adopts the report of the Committee of the Whole. Any further announcements or introductions? Seeing none, Madam Majority Leader. Oh, we do have an announcement and an introduction. Representative Catlin.
Thank you, Madam Speaker. It's an honor to serve with you.
And an honor to serve with you.
Thank you. Members, I'd like to announce that the Ag Council will be downstairs this at noon. If you were interested in what's going on with agriculture, what the concerns are, what we're trying to do, that would be a good opportunity to come down because the producers are there, their lobby is there. It gives you an opportunity to hear what they want, what they're talking about, and maybe have some interactions with them. That's Ag Council today at noon.
Thank you. Representative Story.
Thank you, Madam Speaker. Good morning, everyone. Just wanted to announce that the Capital Development Committee will be meeting tomorrow morning in Senate Committee Room 357 at 8:30 a.m. See you then.
Representative Ricks.
Thank you, Madam Chair. I just want to recognize former Representative Debbie Stafford, who represented District 40. I know she was here earlier, but if you guys could just give her a hand for being here.
Representative Weissman.
Thank you. Members, just because it's been a little bit confusing in the calendar, for the purposes of clarity for everyone here and listening anywhere else in the building, today's judiciary schedule, again, is 1:30 p.m. joint judiciary, House and Senate together after that. So on adjournment of joint judiciary, so 2:30 or 3 probably, House judiciary. There is no judiciary stuff going on this morning. So 1:30 and thereafter. Thank you.
Thank you. Representative Frizzell.
Madam Speaker, it's a great honor to serve with you.
And a great honor to serve with you.
Madam Speaker, I would like to acknowledge former Representative from House District 45, Carol Murray, who was here earlier, and I believe she is with the Castle Rock Chamber of Commerce contingent.
Thank you. Representative Weinberg.
Members, in my hand I hold ice cream cake. If you voted yes yesterday, you get ice cream cake. Thank you, Madam Speaker.
Thank you, Representative. We are going to have to refer this to the Ethics Commission. I'm sure of it. Representative Wilford.
Thank you, Madam Speaker. I just wanted to briefly highlight and recognize former Representative Joe Salazar, who was with us recently. I don't know that he's still around, but just wanted to give him a quick shout out if he is.
Thank you. Madam Majority Leader.
Thank you, Madam Speaker. I move that the House stand in recess until later today.
Seeing no objection, the House will stand in recess until later today.